Expectancy to see what God will reveal to us all.
Talk to you soon.
Love you.
Welcome to A Soldier's Prayer, a veteran's perspective. I'm Chaplain Rocco, your host. Now let's dive right in.
Good morning. Good morning. Welcome to A Soldier's Prayer, a veteran's perspective. I'm your host, Chaplain Rocco. We're going to do things a little bit different today. I brought back another guest, Mariah from Kindred Hospital, the hyperbaric tech. She wanted to come back and explain a little bit more later in reference to diabetes. She has some things she wants to talk about. That's one of the big issues. That's one of the nastiest diseases there is diabetes. A lot of people take it for granted, and it's not what a lot of people think it is. It's not about eating sugar, but it is about your blood level sugar. But before we get into that, let me say a few shout outs to my sponsors today. Battalion Commander Mr. Andre Haynes, Armed Forces Chamber of Commerce, Nevada's first chamber formed to serve Armed Forces member. If you want more information, reach out at 702-518-8847. That's armedforceschamber.com. They're doing great things on there. They've been doing a lot to help the veteran community. We've done some major parades. We've got some that are coming up. We're really excited about it. They've helped a lot of other organizations. I'm telling you, if you're a veteran out there and you have a business or you're intending to start a business, trust me, you want to reach out to the Armed Forces Chamber of Commerce, 702-518-8847, armedforceschamber.com. Next, my good friend and sis, vote for Patsy Brown, Public Administrator. Vote PatsyBrown.com. She's doing her thing. It's getting close to the election. She's ready to do the campaign trail. She's on it. She's an awesome individual. She's got some great things that'll be of assistance, and I've learned a lot about probate since interacting with her. Vote PatsyBrown.com. Also would like to thank Vegas Health and Life CEO Lachelle Buckner, 702-945-8876 for all your Medicare supplement plans, Part D prescription drug plans, vision and dental plans. Next, I'd also like to shout out to the Montford Point Marines Association, Chapter 46. If you're interested in joining, request a presentation, contact Mr. Gary White. That's the Montford Point Marine Association. You can reach him through montfordpointrocco@gmail.com. And I just want to sit up here and say I'm really, really excited this morning to have Mariah here from Kindred Hospital. Before we get into that, I'm just going to give a little word of prayer. Father, we'd like to come before you right now and thank you for this opportunity. Thank you for the many manifold blessings that you have brought to this scenario, this ministry. Thank you for these special guests that come out here out of their way to want to be able to help your servants that you have entrusted to help guard your nation. We ask that you give everybody wisdom and understanding. Amen. Mariah, how are you today?
Excited to be here.
You're excited to be here? So what I'm going to do, I'm going to just shut up and let you talk.
Oh.
And then it'll be okay. She didn't want that one, guys.
No, I didn't.
But what I'm going to do, I'm going to let her explain some things that she wants to say. And then from that, I'll ask you some questions based upon some things I hear. How about that?
Okay.
You can deal with that?
Maybe.
You got it. I know you got this.
So I was on the show a couple weeks ago, and I was talking about hyperbaric medicine and how it helps certain indications or certain diagnoses, and one of them is diabetic wounds. And we get a lot of patients who never knew that hyperbarics was an option. They've tried multiple different things. They've had amputations, and then they finally come to us, and they want to know why they weren't sent to us before the amputation. So if you have a diabetic wound, any stage, and you're getting wound care or you're not getting wound care, call me and we'll go over every opportunity that's available to you. But just know that hyperbarics has the potential to help you heal from the inside out, new vessel growth, new tissue growth. It works along with wound care, with antibiotics, physical therapy, all the other things that you're doing to get better. And it's basically an added bonus to all those other things.
Wow, a lot of information. Thank you. For my listening audience, if you have a question you would like to ask Mariah, you can call in at 702-650-5588. That's 702-650-5588. Mariah, you said some interesting things there in reference to diabetes. I'm a diabetic. I've only had one scenario that kind of got into the wound situation, and that was one of my left big toes. I went to have a pedicure, and I got a little nick on it one time. And luckily that I acknowledged it fast, because that's something us diabetics have to really watch, is wound care.
Right.
Something as simple as that. It can be in the finger, any part of the body. But it was on my big toe. And what I found, that I had some ingrown toenails that was cutting down also into the wound.
Yeah.
And if I had not gone to the doctor when I did, that could have been a potential disaster later. I remember such things when my father, rest in peace, he was a diabetic. And I remember when he had to amputate the bottom part of his leg. Now, you're talking about a man who was a professional athlete. And when he got to the point that he couldn't run or do things anymore, he became a different person mentally.
Right.
And what happened was, he got to the point where he gave up. We tried motivating and doing things, and he would play the position, so to say, while we're there. But when we left and he was just really dealing with himself, that bothered him. So one of the big things I used to have to come in and do, I would always come in and check his body, try to make sure everything was good, right? So I started remembering when his foot, before he started having a lot of swelling and bruising in his foot, and I never understood what that was about. But what he did one day, he had his foot ran over by a wheelchair. Okay, and that did a lot. And it's kind of like the blood cut off in that one area, and then you can start seeing over time that foot turning colors. And, we got him to the doctor, and the doctor told him what was happening, so he was trying to treat it and see what he could do. Then about 6 months later, after that, they ended up having to take the whole bottom part of his leg off. And if anyone has dealt with diabetes and diabetics who've been in that scenario, that's a hard situation for that individual.
It is. Diabetes, when you get diagnosed with it, I'm lucky and I haven't been diagnosed with it, but you think, okay, well, there's something wrong with me. But, you can be underweight, overweight, average weight, young, old, it doesn't matter. And what you need to realize is, now that you're given this knowledge, there's this whole other thing that you need to look into. You need to start doing body checks, like Chaplain Rocco was saying. Get a good podiatrist that can trim your nails for you, that can do foot checks, especially if you have neuropathy, which is a loss of feeling in your feet or in your hands too. Get some good medical people that you really trust, that you can go to and ask questions that will help you with this disease, and that can guide you through the course of treatment.
Mariah, I love that you said that, because after that incident with the pedicures, I haven't been back to a pedicurist, but what I did find out, and you are correct, and luckily through my medical insurance, I could go to the podiatrist's office and they can do pedicures for diabetics. Excuse me, they do that. They offer that option. But a lot of diabetics don't know that, because they're thinking it's going to cost them so much or what have you. Well, if you happen to pay out of pocket, that is kind of costly.
It can
But
be.
but majority of our vets that are listening, they have insurance. The ones that do, you can go to podiatrists, and I prefer to do that. So if anything happens, if I'm nicked or whatever the situation may be, at least I'm already there with the medical professionals. But you have to be really careful, diabetics, when you go out to the different salons. I'm not taking anything away from them, but they're not how do you say, dealt with for medical treatment.
Right.
And like I said, when you're dealing with things such as a possible loss of limbs, you need to be with the best. And you also said, when you were speaking in reference to, it's just, I'm just kind of excited hearing you here when you said the word podiatrist, because a lot of diabetics do not understand that there's other physicians that we need to speak with, like endocrinologists. All of those have something to do with that. And like you said, in reference to diabetes, does not discriminate. It doesn't care if you're slim, big, overweight, whatever the scenario may be. Okay, when I first was diagnosed with diabetes, I was 265 pounds. Okay, when I went into started holistic eating and living and working out and things like that, it transitioned for me. I'm down now to 212. Okay, and it's been a great thing. But what I'm also starting to see now, just like anything else, it doesn't matter if you're taking medication. Let's say you got pain in your back, you start taking medication. After a while, the body adjusts to everything. So what I'm starting to see right now, I've lost the weight, my diabetes is in remission, my numbers have just started to spike a little bit, and I'm starting to find out that I'm urinating more. So what I'm starting to think is happening, that my body has got accustomed to the intermittent fasting that I was doing, because I was only eating 1 meal a day. Okay, so now I think my body's telling me to put a little bit more in me. And you said right before we started about I should try more supplements or something. Go ahead.
So my husband actually, he got diagnosed with diabetes on his birthday quite a few years ago, and he didn't want to take the medication that they prescribed him. So I told him, I said, give me a couple months. Let's try these supplements, and then I can almost guarantee you that it'll be much better.
Okay.
So he takes a lot of things for circulation. There are certain things that you can take to keep your sugar levels down or stable. And there's certain different foods that you can eat too that help with blood sugar levels, not to spike them up, but to help keep them at a normal level. And I think a lot of people don't know that, or a lot of physicians don't talk about that. They just talk about the medication that you need to take and to lose weight and stuff like that. And there's so much more that goes along with getting your blood sugars down.
It's interesting you say that, because you bring back a lot of memories. My late stepfather, he was one of those male RNs when it wasn't popular for a man to be a male registered nurse. I imagine, I'm 60 now, so I grew up with a stepdad who was a male RN back in the 60s and 70s. Right?
I think that's awesome.
Yeah, I do now for sure. I didn't look any bad way at it then, but it was just uncommon during that era for
it's
that.
It's definitely more common now.
And he used to tell me a lot of the things you were saying right now, and as you were speaking, that just came back into remembrance in a lot of ways. And then, you hit something on the head, and the reason I brought that up, because he used to tell me back then that a lot of the medical facilities, a lot of the doctors, a lot of the clinics, and then when I started going to the different offices with him sometime when he started doing private duty, I started seeing all the pharmaceutical salespeople that would come in. And they would come in, it was kind of like they were doing a bartering situation with these medical facilities. If you sell our medicine, you might have 5 different salesmen coming in trying to sell the same medicine. Whatever company would offer the best scenario, that's what the doctor was pushing. So it was like the doctors were actually pushing the drugs, but they were not teaching us how the holistic aspect, how can we naturally heal ourselves? What are the natural supplements? What about our diets? What are some of the better things to eat? I was one of those kids, I had a big appetite, and I used to laugh because one day I heard the former basketball player Shaquille O'Neal said that he loved to eat so much that when he would go to buffets, he'd have to eat dessert first, because at the end of the meal, he would never have any room. But even as a kid, I wasn't big as Shaquille, but I was like that. And I'm still like that. I like to eat my sweets first.
I do too.
You do that too. So what I'm saying with that is, I think more of our medical professionals should make us more aware of the things that are better for us to eat. See, just because one's a diabetic does not mean we can't have desserts, but we have to watch in moderation how we do things. You get what I'm saying?
And there's so many more things out there now, sugar-free things, keto, all that kind of stuff that can really help. And it's just about doing research and finding what works best for your body, because I'm not, but I could be diabetic too, and what works for you wouldn't work for me, or vice versa. So you really got to learn about yourself and not just the disease.
It's funny you say that, because you are correct. Every diabetic is different. Now, like right now, I'm going to pull this out. You're going to hear this noise. I got 2 bags of candy in my pocket. One's like a cherry slice, the other one's a cinnamon bear.
Oh, okay? I love those.
But I know I'm crazy about these things. They're like 2 for $1 in the store. But what I've learned, I have very high blood sugar. So you have hyper and then hypo.
Yeah.
I have a good friend of mine, he's hypo. He has low blood sugar. Now, I'm walking around with 2 packs of candy in my hand. This is not for my diabetes. This is just because this is what I like. Okay, but if I was in the low scenario and I'm having the circumstances, these would come great and handy to bring my sugar level kind of back to normal. But this is not the only best way to do that. But see, and this is what even my own doctor told me. He said, well, keep some candy in your pocket and keep a couple of sodas in the cooler in your car. And I'm thinking, wait a minute, you're defeating the purpose.
Well, it kind of depends. So my blood sugar, because I tested, because my dad was diabetic.
Okay.
And so I test mine just to make sure I'm not getting away with myself. So mine on a normal average every day is probably in the 80s, which is a little bit low, but not terrible. So your cinnamon bears could really help me out sometimes. But
I got 2 bags right here on the table. Go ahead.
like we said, everybody is different. So what works for one wouldn't work for another. And that's the same with wound care too. So you have all these different wound care topical creams, agents that you can use. And what works really well for one isn't going to work as well for another.
So you said something that was just like related to food, even with the wound care.
Yeah.
They have various treatments for that. Some topical creams, but that just because it worked for you does not mean it worked for me. So we have to also make it the responsibility of making ourselves knowledgeable.
Right.
Not just depend on our medical providers all the time either. You take their advice, study it, go see if what they're saying is so, and then try it. It may not work for you. You might find something else that works better.
Right, and that's the thing, like, medicine isn't an exact science, so it's all about finding out what works best for you. And you can try one thing and maybe you just need to up the dose a little bit or change it a little bit. So don't ever get frustrated or anything like that. It's just a matter of finding out what works best for you and really keeping an eye on what's going on with you and your body, how you feel, how you sleep, how many times you use the bathroom, if your feet are swollen, not swollen, if you're losing feeling in your feet, a whole bunch of things that people need to pay attention to.
It's interesting. I love that you said that, because you said several key things. Use the bathroom. I've noticed when I first come into remission of my diabetes, I didn't have to urinate a lot. Lately, I've been getting up 4 or 5 times in the night. So that's a sign to me that it's trying to rear itself again. And reason I know, because I do test my blood sugar on a daily basis. Now, when I was first diagnosed with diabetes, I probably had over 500 or 600 sugar level for over a year and did not know it. So when I went in, I found out that my kidneys were possibly trying to shut down. And I noticed when you urinate, you see the bubbles. That's the ketosis. That's okay. But so what I'm seeing now, I'm getting ready to go back and start doing some things different, because it may be now that I got so great when the numbers got so, because I got down from a 600 to a 80 to 110. I got so excited. I kind of veered from my diet. I said, I can start doing a little bit more of this. But one of the key things I think that's changed why it's happening now, I was going to the gym every day. Now I haven't been to the gym in about 3 months. Okay, and I believe that has a lot to do with it.
Well, it does. So if you don't move around, you get stagnant. You don't want to do anything. You get unmotivated, and then things start to go downhill again. But so when we're talking about blood sugars and high blood sugars, it doesn't just go one day it's normal and then the next day it's screaming high. It's a gradual increase. So there's things that your body tells you that something's going wrong, that you need to check it out. And it might not be diabetes, it might be headaches, visual changes, different feelings in your fingertips or your feet, bowel changes, going to the bathroom, sleeping, irritability. So there's a whole lot of things that our body tells us that sometimes as humans we just decide to ignore. But don't ignore them, because it could lead to something really huge.
I agree with you on that, because like I said, I was going to the gym 5 days a week. My sugar levels were, everything was fine. I started going through the back pains, and then I stopped for 90 days because I having dental scenarios, what have you, and I stopped. And now I'm starting to see this again. So now I'm ready to get motivated to get back in. I notice myself with my clothes now. It's like I almost have to need a whole new wardrobe, because I've lost so much weight that everything doesn't fit anymore. A good friend of mine, she told me the other day, we said, no, we're just going to go take those suits and things and tailor them, right? Which is good. But, you did say my mom had neuropathy.
A lot of people do.
That's an ugly thing. And I used to watch her struggle with that. I never understood what it was. I thank the Most High that I didn't end up with neuropathy, but because I've seen some diabetics with some serious issues. So all I want to say, and I'm glad that you're here today to share your expertise, information, and we appreciate it so much to a lot of our veterans, because there's a lot of veterans that do have diabetes. I see them at the VA hospital all the time. But I want to tell them to not take that lightly, because diabetes, and I'm going to say it again, I said at the beginning, it's a nasty disease. If it's not treated and cared for, it will take you out. It really will. It causes other issues: kidney failure, stroke, heart attack,
visual changes.
See, I got the new glasses, because you're correct. It does. It really does. I started noticing at night, if I'm looking at my phone or my pad, I'd almost have to squinch, because it was like my vision, I couldn't see. Even, after a while, I might start off seeing well. Then as we go on, the fatigue comes on. But over the time, I thought, well, maybe my eyes are just getting tired. But I found out, no, my visual was changing. So I had to go get new glasses. And one eye I found out was worse than the other eye. And he has to give me medication for one eye. So now that I have the glasses, guess what? I get charged like for 2 pair of glasses with one glass, because each lens is different. So when you go to the ophthalmologist, boom. But I want to also tell I'm sure you can believe this, I'm sure you can confirm this, I want to tell my veterans, when you're going to the VA and you're getting your eyes checked, make sure you tell your ophthalmologist, because I know they don't do it unless you ask. Tell them you want to have the diabetes eye exam, because I was able to do that, and that's how I found out a lot of things. And what I'm starting to find is a lot of facilities, it costs more, but they don't tell you if you don't ask about it.
When there's a lot of, you can go to an internal medicine doctor, and he's a wonderful doctor. But there's internal medicine doctors that really specialize in diabetes, or you can go to an endocrinologist who can help you with it. Make sure whatever provider you go to knows everything about you, because that makes a difference. My husband, he hurt he had a corneal abrasion that wouldn't heal for years. And he finally told his eye doctor, my blood sugar is a little bit higher than what it should be. Can this make a difference? And yes, it could. So we started him on a collagen supplement, which helps with connective tissues. And with the procedure he had and the collagen and the medication that the eye doctor prescribed, now he's doing really well. Had he not mentioned it, who knows where we could be right now.
That's really, you are such a pleasure having here, because you're confirming a lot of things right now in my mind that I've studied on my own. Now to hear from somebody in the field tell me, and it means so much to me, because like I said, all my listeners, and I have some friends who are listening, that midsection, that extra weight in the belly, trust me, that's a leader towards diabetes. A lot of folks don't believe that, but it's true.
When I think too, when you're given a certain diagnosis, say like anxiety or depression or PTSD or diabetes or certain other things, we become embarrassed by it, and there's nothing to be embarrassed for. Everybody has something that they need to deal with, whether it's diabetes or mental issues or anything like that, and it's all a matter of accepting it and getting to learn what works best for you and accepting it. And it's not anything to be embarrassed by, and just know that there is somebody that wants to help. A lot of people want to help.
Rod, thank you so much for that. And my listeners, my veteran listeners for sure, she said key words that we relate to very well: PTSD, anxiety, depression. To me, there ain't a veteran alive that have not experienced one of those scenarios. You could not have, and PTSD is not what everybody just thinks it's your whack job.
No. So I'm not a veteran, but I have all those things: the PTSD and anxiety and depression. And when I was first diagnosed with it, I was kind of embarrassed, because it came from a childhood trauma and stuff like that. And then I realized that it makes me who I am, and I love myself, and it just makes me more tolerant of others, and it gives me a leg up to help other people too. And
Okay.
the more you learn about yourself, the better you can help someone else.
You know what? I salute you for saying that. A lot of people will not come to grips with that. I had to learn to do that myself. Before we run out of time here, though, I would like for you to give us information about how our listeners could reach out to you or reach out to the Kindred, your department, the whole 9 yards. Can you do that for me?
So my office telephone number is 702-790-0840. Call me, ask me questions about hyperbarics, about wound care. If you're looking for advice on a good podiatrist, I have one that I really work well with. I love him very much. So any medical questions you have, and it doesn't have to be about hyperbarics, I'll help you. So again, my phone number is 702-790-0840.
And that's at Kindred Hospital.
5110 West Sahara Avenue, Las Vegas, Nevada, 89146.
And that is the hyperbaric department?
Yes.
Okay, very good. Hey, you guys need to really go out there and listen and go check that out, because, like I said, being a vet myself, it looks like a big submarine in there. I love it.
And also, if anybody wants a tour, call me,
nice.
and I'd love to have anybody come down and see what we have to offer, meet the staff. One of the staff members is a Air Force veteran. He's been with us for 21 years. He did hyper and hypobarics and built flight suits, and he's a really awesome guy to talk to as well. So just come on down and meet everybody.
Hey, I'm looking forward. Mariah, I want to thank you so much for joining us today. And like I said, you always have an open invitation to come in, and anytime you get any more advice or anything like that, do you think there'll be great access to my listening audience, please feel free. This is not my show. This is our show. That's the way I like to look at it, like that. And the audience, we're about out of time here, but I just want to say thank you for listening in. Stay tuned. Have some other things that we need to talk about starting as next week. A lot of exciting things are happening for our veterans community right here in Las Vegas, and getting ready to be other surrounding areas too. So with that being said, God bless. Keep hope alive. Stay true to yourself, and remember to still be about the service. Peace. Thank you so much. Thank you, Mariah.
Thank you.
Well, there you have it, folks. Another rendition of A Soldier's Prayer, A Veteran's Perspective. I'm your host, Chaplain Rocco. For correspondence, reach me at P.O. Box 34572, Las Vegas 89133. Information line 775-292-2378. That's 775-292-2378. Or you prefer to email me, veteransviewservices@gmail.com. That's veteransviewservices@gmail.com.